Welcome back to Adapt NCLEX. Today, we're going through another 85 NCLEX practice question, focus on most tested concept you will see on your exam day. If this is your first time taking the test or you're already taking the test, stay with me. These questions are designed to simplify the content and show you exactly how the NCLEX is thinking and how you should approach them. The questions get harder and harder. We're going to start with EKG. Stick with me. I'm going to make it easy for you, then followed by prioritization, delegation. Are you ready? Let's get to it. First question, like I said, EKG. What is the question? How do you answer the question? Read it from the back. Which of the following should the nurse recognize as the most likely cause of what? This rhythm strip finding. It's a select or apply. A nurse is caring for a client on telemetry unit. The nurse reviews the client cardiac rhythm strip and notes the following, the finding below. Which of these the nurse should recognize as the most likely cause of this strip? All I'm saying is there is a strip. What is causing the problem? And I've given you options: hypokalemia, hypomagnesium, hypocalcemia, amiodarone, ondansetron, azithromycin, methadone. There's a theme among the answers. If you can't figure out, go back to the question. How do you answer it? Look at the main thing. He said, what is causing this rhythm? What is the rhythm? This is the rhythm. What do you see? There is something there. What do you think? Before I give you the answer, what do you think? How do you benefit from this video? Pause the video. Pick your answer. Lock it down. Then listen to me and I'll give you the answer. Did you pick an answer? Which of those is responsible for this EKG strip? I can tell you the right answer is all of them. All of them is responsible. Why? The question asks you, what is responsible for this? And you click on the EKG strip, you see what? Torsades de Pontes. How? These are all ventricular rhythm. This is a different kind of ventricular rhythm. Another ventricular rhythm, different kind. You can see this rhythm is the same as that, and that rhythm is the same. What we're seeing is meandering of the ventricular rhythm with polymorphic features. This is what we call Torsades de Pontes. What causes Torsades de Pontes? QT prolongation. That's all. Anything that causes QT prolongation should be responsible for that. Hypokalemia causes QT prolongation. Hypomagnesium, QT prolongation. Hypocalcemia, QT prolongation. Amiodarone, QT prolongation. Ondansetron, methadone, QT prolongation. All of this causes QT prolongation, and therefore they can lead to Torsades de Pontes. Write them down, put them down, know this concept, memorize them, that these are the medication causing QT prolongation. Next question. A nurse is caring for a client on a tele unit. The nurse reviewed the client's cardiac rhythm strip below. Which electrolyte imbalance should the nurse recognize as the most likely cause of this rhythm strip? High level of magnesium, hyperkalemia, hypocalcemia, hypercalcemia. And what is the rhythm? This is the rhythm you see. How do you answer EKG question? Don't worry. There will be a clue in the question. It said an electrolyte imbalance causing this rhythm. And I've given you the causes. What do you think? Pick your answer choice. Put it in the comment. Hashtag number 2. But what do you think? Based on this, you can see this is what? What do you think? The right answer is hypocalcemia. Why? This is a QT prolongation. If you look at the EKG carefully, there's something here. This is the P wave. This is the QRST, right? And this is the T wave. Look at here. From here to here is too far. This T wave is moving away from the QRS complex. T wave moving away. T wave moving away. It's so far away. It's too long. This is what we call QT prolongation. What is the most common cause of QT prolongation? Is hypocalcemia, hypomagnesia, and hypokalemia. Therefore, This is your right answer. Number 3, a nurse reviewed the tele strip of a client. What is the problem? The medication in the client chart is most likely responsible for what? This strip. Did you see it? Does it look something similar to that? What is that? Lisinopril, azithromycin, metoprolol, and lorazepam. I'm giving you a few seconds. Think about it. Lock in your answer. Put it down. Once again, this is the strip. What do you think? If you look at it, this is what? Torsades pontis. The same rhythm I show you, but different picture. You see this rhythm is the same. You have ventricular rhythm going back and forth. Torsades pontis. What did he say? What did we say is the problem? QT prolongation. QT prolongation. Which medication causes QT prolongation? It's not lisinopril. It's not metoprolol. It's not lorazepam. It's what? It's azithromycin. This is what causes QT prolongation. That's the right answer. We finished with the 3 hard EKG. Now let's make it prioritization. You have to master this concept. Which client need should the nurse address first, according to Maslow? What do you think? Is the concept client anxious about surgery, what, tomorrow? Client reporting severe pain? Client who has what? Not voided in 8 hours? Client requesting spiritual support? How do you answer this question? Concept. Write it down. What concept you're supposed to know? Maslow, what does Maslow say? Physical need is number 1. Which of this is a physical need? It shows has nothing to do with physicality. Pain is not the true physical need. Who has not voided? Elimination is better physical need. Client requesting spiritual support is not a physical need. Therefore, which one we're going to pick? Which one did you put it down? Let me know. Is voiding. This is elimination. That's a physical need we should worry about. A nurse is caring for 4 6-month-old infant. Don't worry. Pediatric prioritization is all buzzword. Go for the concept. Don't worry about the age. Don't worry about anything. Write these things down. I'm worried about concept. Passive spit up after what? Feeding. What do you think? A kid who spit up after feeding. Forceful projectile vomit after feeding. What concept is that? Mild irritability after feeding. What do you think? Choking after feeding. Guess what? All of them is bad. Pause the video, put down your answer in a comment. But what do you think is the right answer? I can tell you, number 4 is the right answer. Why? Passive spit up after feeding is a reflux. It's not the problem. Forceful projectile vomiting is what? Pyloric stenosis. You're going to get dehydrated. It's bad. Irritability after feeding is not good. But when you're choking, it's an airway problem. This may be tracheoesophageal fistula problem. This patient is in trouble. Which maternal client should the nurse assess first? Prioritization 101. How do you do that? Go for the concept. Divide the thing into 2 and find the difference between them. That is the concept. A client who just delivered, what is the problem? Uterus is bulgy. I have a problem with that. A laboring client shows the total sign. I'm worried about it. Client with what? Painless vaginal bleeding with the placenta cervical os covering. Okay, I don't like it. 6 hours postpartum and you have excessive urine. Which condition is bad? You have to be sharp. What do you think? Which one would you pick? Pause the video, put down your answer, and let me know. I'll give you the answer, then give you the explanation. Which one should you worry about? We worry about what? This patient. Why? Number 1, a client who just delivered and has bulgy uterus may bleed. Laboring client with the total sign. That means the baby is not coming out. The baby head goes in and out. This is shoulder dystocia. Bad problem, bad problem, bad problem. That's an airway issue. If you don't deliver the baby within few seconds or few minutes, the baby is in trouble. Painless painless vaginal bleeding, placenta covering cervical os. It's also bleeding. We have 2 bleeding problems. I don't worry about it. 6 hours postpartum with excessive urine expected. It may be due to Pitocin. Who's in trouble? Kid with shoulder dystocia. Baby, mother who is having a baby with shoulder dystocia is more dangerous than all the rest. Therefore, I'm going to worry about that patient. That's the patient we're going to see. Where does this question come from? This is Adaptation plus QBank. They may look a little bit difficult, but they are test-taking strategy to help you master. When you go take the NCLEX, it's easy. The client is receiving a blood transfusion. The nurse team is made up of RN, UAP, LPN, which tasks are appropriate for a UAP to perform. Select or apply. This is delegation. We've moved to delegation portion. What is the key for delegation of a UAP? Require thinking that will require an assessment, evaluation. They are not going to do it. All they care about is ADL. But what is the question is blood transfusion. Therefore, give them something that is consistent with what? Not requiring them assessment, evaluation, treatment. Collect the blood from the lab. Can they do that? Put down your answer. Let me know. Check urine output color during the transfusion. Do you think they can do that? Check client vital signs before the blood transfusion. They can do that. Check the patency of the venous access. Report hives or other signs of transfusion reaction. Can they do that? Stop the transfusion if the client becomes diaphoretic. What do you think? As you can see, put down your answer, stop it, and let me know. But this is the answer I can give you. And then with the explanation, collect the blood from the lab. They just go and tell the lab, we need blood. That's all. They can do that. There's nothing wrong with it. Check urine output color during transfusion, requiring an assessment. They are not supposed to do that. Check client vitals before the blood transfusion is okay. Check the patency of the venous access is an assessment. Report hives. I'm just reporting. I'm not assessing. I saw something and I report. Other signs of transfusion, I can do that. They cannot stop the transfusion if the patient becomes diaphoretic. They can call the nurse to come in, stop it. So those are the right answer. Does that match what you select? If not, let's keep on going. We're going to ace this test. 85 questions, key concept. We're going to show you all the things you need to know. Write it down. That's all. Which tasks are appropriate for LPN to perform? Select or apply. A client is receiving blood transfusion. 1, administer the blood transfusion. Can the LPN do that? Monitor the client for signs of transfusion reaction after RN started infusion. Verify the blood product with another nurse prior to administration. Document vital signs and client's response during the transfusion. And initiate the transfusion independently. What do you think? The way I deal with LPN is what? I call it MMR most. That means they can monitor most medication. They can reinforce. They can do what? Ostomy care, special test, stomach care, and they can give most medication. But they can monitor, reinforce. They cannot provide teaching on assessment. They cannot do first of everything. The nurse has to do that. Therefore, what do you think they will do in this situation? This is what I will pick. And I know you get the answer. They cannot administer the blood transfusion right away. It has to be initiated by the nurse. Monitor the signs of transfusion reaction after RN has started it. You can see M is consistent with that. Verify the blood product with another nurse prior to administration. They cannot do it. You need another RN to do that. Document the vital signs and client response during the transfusion. Require what? Monitoring. They can do that. Hang the initial blood transfusion independently. They cannot do that. So the right answer are the B and D. So those are the 2 answers. But these are concepts I want you to master and know them. Another delegation question. Don't freak out. You know the concept, write it down. MMR most, or anything that does not require thinking for the UAP. A registered nurse is caring for a client with what? Right-sided hemiplegia. It does not matter. He has stroke. Following a stroke. Which tax is appropriate to the LP? Which tax is appropriate for the UAP? What do you think? The UAP, ADL, that's all. Perform range of motion exercise on the affected extremities, assess the client's neurological status and vital signs, teach the client how to use a walker safely, administer scheduled oral medication. I said anything that does not require thinking. ADL, administer something negative. Teach the client how to use the walker negative. Assess the client neurological, you cannot assess. Therefore, passive range of motion is an ADL. It's an ADL. Did you get that the same answer? I know you got it because you watched Adaptation. Number 10, halfway. What do you think? We've moved to what? Physiological adaptation. I take you from hard questions, go up and down. That is the way the questions are going to be. If you make it to number 10, what is your score? I would like to know. But this question is a little bit difficult, but it's not. If you used the concept, so I want you to write it down. With finding are expected, select or apply. A client falls from a 2-story building. The nurse suspected neurogenic shock. Write it down. It's the key word in the question. Which one should you see? Hypotension, bradycardia, warm skin, tachycardia, and decreased peripheral pulses. Think about it. I give you 2 seconds. Which answer choice do you lock in? Put it down in a comment. Let me know. That is how you can benefit from watching this video, answering the questions yourself, and see if you get it. Then you write the concept the way I approach it. But the way you should approach it is what? Neurogenic shock. You don't have any nerves anymore. That means your sympathetic nervous system is gone. That means your parasympathetic nervous system is in play. Your parasympathetic system will put you down. You have what? Bradycardia. Your blood pressure is going to drop. Your skin will look what? Warm because there's too much blood there. If you're bradycardic, you're not going to be tachycardic, right? That's no-brainer. And because of lack of resistance, that's why your blood pressure is lower. You have decreased peripheral pulses. This is shock, and I want you to know it because it's a traffic question. Most people have issues with neurogenic shock. Write it down. Number 10. Number 11. A nurse assesses a client with right flank pain radiating to the umbilicus, right? Physiological adaptation. Patient has fever and dysuria. Which condition is most likely? Can you make a diagnosis based on the symptoms? That's what one of the subscribers told me. They're giving you symptoms and you have to come up with the diagnosis. Is it pyelonephritis? Is this a kidney stone? Is it cystitis and BPH? What do you focus on? Look at what they've given you. They're giving you umbilicus, pain going there, fever, and dysuria. Therefore, if this is the patient, he has frank pain going to the umbilicus, and then dysuria. What do you think? Locking down your answer and put it down, let me know. Few seconds, let me know what you think. But I can tell you the right answer is what? Pyelonephritis. Why? BPH, you don't have frank pain. It's gone. Cystitis, you may have some fever. You don't have frank pain. It's mostly suprapubic pain. You have pain here. That's bladder infection. It's gone. Kidney stone, you may have frank pain, but it goes where? Into your groin. You see, location. By default, number 1 is your answer. That's the one you're going to pick because the pain is going to your umbilicus and you have fever, you have dysuria. This is a bad kidney infection. This is the true kidney infection. A nurse is planning care for a client who underwent what? Total thyroidectomy 6 hours ago. Which intervention should the nurse include in the plan of care? Keep the client in high fever position with the head and neck upper extended. Place a tracheostomy tray at the bedside. Encourage a client to cough and deep breathe every hour. Administer aspirin for postoperatively discomfort. What do you think? Total thyroidectomy in your neck. We remove it. What do you worry about? Airway and bleeding. Which answer choice should you include? Airway and bleeding. Pick your answer. Let me know. I give you the concept. That's what I want you to write it down. You see, every concept I use 1, 2 words and I use it. If I'm worried about your airway and your bleeding, why would I have to give you aspirin? Negative. If I'm worried about your airway and bleeding, why would I tell you to cough? Negative. If I worry about your airway and your bleeding, A, I will have a tracheostomy at the bedside. If I worry about your airway and your bleeding, I will not let you hyperextend your neck. That's your right answer, B. And this is assessing a client with what? Major depression, right? Which finding require highest priority? What do you see? What do you see from this question? We've moved to mental health. Mental health concept. I want you to master it because mental health is a key. It will come in your NCLEX. You get it. But there's a concept where you approach them. Don't overthink it. It's right there in front of you. Prioritization 101. Major depression, right? Report feeling hopelessness, withdraw from family and friends, donate the house for charity, difficulty sleeping. Ask yourself, if I'm depressed and I have difficulty sleeping, is there a bad thing? Unexpected finding. I'm hopelessness. Is bad thing. Way expected, but at the same time, worry about it. Withdrawn from your family. Unexpected finding, but still worry about it. Isolation. Donating your house for charity. I'm worried about it. Which one would you pick? Put down your answer, let me know. But I can tell you, donating to charity means you're giving up. That's the last thing. If you donate your house, you're not coming back to that house. You're done with the rest of the world. Who donate the house? You may have 500 houses. No, this patient is gone. It's okay to have difficulty breathing. It's okay to have what? Hopelessness. It's okay to withdraw. But when you donate, it's suicidal. That's your right answer. The client with schizophrenia said the FBI is watching me through the TV, which respond by the nurse demonstrate therapeutic communication. Hey, somebody is watching me. This is not true. No one is watching you. I understand you feel frightened. Let's talk about what is happening right now. Stop thinking about the TV and focus on meds. Ignore the comment and change the subject. Every time you see therapeutic communication, please ask for more. Once again, ask for more. Acknowledge the person and ask for more. Which answer choice showing that? What do you think? 1, not true, arguing, negative. Understand how you feel? I'm acknowledging. And he said, let's talk about what happened right now. Hey, asking for more. Stop thinking about the TV. You are not acknowledging the patient. Ignore the comment. I'm not going to ignore it. Patient care. We got to accept what they're saying, but not rationalize it. Bring them to reality and let them know that this is what I see. I don't see what you see, but I know how you feel. With statement by the nurse is an example of therapeutic communication with the client experiencing anxiety. Same strategy. Don't change it. Just because I change it from schizophrenia to anxiety, stick with it. Same thing. Ask for more and be therapeutic. Acknowledge their problem. Don't worry. Everything will be fine. What do you think? I notice you are pacing. Tell me what is making you anxious. You need to calm down before we continue. Stop worrying and focus on your breathing. You see, the question answer choice look the same. Wherever you go, this is what the answer choice will be. But if you know the concept, it does not matter. I'm not saying you're going to see these questions on the NCLEX. No, I'm saying you will see the same concept. So I'm showing you how to pick apart the question so that you can answer them and be successful. For this question, ask for more, acknowledge. Which one? Asking for more, acknowledge. And notice your pacing. Tell me more about what you're doing. This is my favorite. Delirium, Alzheimer's, and depression. Key. Delirium, Alzheimer's, depression. I want you to know these 3 Ds because they are friends. They show up all the time. And next, as attend the staff education program on mental health concept. Which of the following response from the nurse indicate correct understanding? I have three problems: delirium, Alzheimer's, depression. Which one has acute onset? Which one is progressive? Which one you can reverse it? Which one is just happening back and forth, episodic? Which one has remote memory intact? What do you think? Put down your answer and let me know. But this is next generation question in the table form. Don't run away from it. Delirium means acute onset, expected finding. Alzheimer's is progressive, it's not. Depression is not acute onset. That's all. Progressive, that means it keep on going on. Delirium is not progressive. When it happens, that's all. It's not progressive. Alzheimer's will continue and continue. You lose your memory forever. So it's expected. Depression is not. It comes back and forth. So that is episodic. So this one is depression. Therefore, this is not expected. This is not expected. Which one you can reverse it? You can reverse delirium, but you cannot reverse what? Alzheimer's. You can reverse depression. We can treat it. Whose memory will be lost, right? But they're going to keep remote memory. It's mostly Alzheimer's patient expected. You don't see this in delirium or depression. This is the way I want you to know them. Thank you for watching. Number 16 is key concept. I want you to mark it and come back to it every time. Number 17. A nurse care for a client recently diagnosed with colon cancer, which statement indicate ineffective coping. Write it down. Ineffective coping means they are not adapting to the situation. That's all. That one word, I'm going to use it to underline each question. I don't want to talk about it. Nothing I do will change anything. I am writing down questions to ask about what? Ask my provider. I asked my sister to come with me to treatment. I'm learning about my treatment option. What do you think? 4 options. Which one indicate I'm not coping? Hey, if I'm learning about treatment option, I'm welcoming it. I've accepted it. My sister is coming with me. That's good. I'm writing everything down. That's great. If you don't want to talk about it, ineffective coping. Which of the following statement finding will be expected about what? A nurse is assessing a client with hypothyroidism. What have you noticed? We've shifted a little bit to endocrine. The thing that I'm doing today, and make sure I give you every little thing the NCLEX will give you. Endocrine, don't forget about it. It's key. What do you think? Hypothyroidism. Well, weight loss, warm skin, heat intolerance, diarrhea, and decreased libido. Concept. Take your pen, paper, and write it down. Everything about hypothyroidism, one word. All your symptoms is going to do what? Go down, except your weight. Once again, all your symptoms is going to do what? Go down, except what? Your weight. That means your weight is going to go up. Do you see weight going up? This is a weight loss. I don't expect that. Warm skin, your symptoms supposed to go down. Therefore, your skin is going to go cold. Heat intolerance is going up. Your skin is going to get what? Cold. Diarrhea is going up. You're going to have constipation. Decreased libido is going down. Therefore, this is the one. Select or apply. NCLEX practice question. Don't over-select. This is a SATA question. Don't over-select. Pick the one you're confident about. There's only one answer choice. If you over-select, you're going to lose point. Therefore, pick only one answer if you know it. There's only one answer there. And this is caring for a client who is immediately post-op following parathyroidectomy. We remove not the thyroid gland, but the small gland behind the thyroid. They are responsible for calcium metabolism. That word I said, I've given you the answer. This is the way I want you to think about questions. You don't read everything, but you focus on the buzzword. That's parathyroidectomy means I'm dealing with calcium metabolism, not the thyroid. Which medication should the nurse anticipate as part of post-operative plan of care? When we remove your parathyroid, your PTH go down, therefore your calcium go down, and your phosphorus goes up. All I need to do is to give you some calcium. Which one do you think is going to happen? What do you think? What do you think the nurse is going to do? What are we expecting that will happen? Put down your answer. Let me know. But look, we're going to give you calcium, and we give you all form of calcium. IV calcium to replace the immediate calcium right now. We're not going to give you levothyroxine because your thyroid gland is still there. We're going to give you oral calcium that will help you maintain your calcium. And then we give you vitamin D that will help you absorb calcium from the GI tract. We're not going to give you potassium. This is something I want you to write it down. Parathyroidectomy, they need IV calcium, oral calcium, and vitamin D. Key concept. Which laboratory findings are consistent with Addison disease? Endocrine, Addison disease. Sometimes it falls under physiological adaptation. Select and apply. Then you ask yourself, what is the key about Addison? I want you to pick the answer choice and put that in the comment and let me know what you think. I give you a few seconds to select your answer and then put it down in your comment. Then I'll give you the content. What do you think? I can tell you, Addison, there is no aldosterone. If there's no aldosterone, sodium is down. Is sodium down? Yes. If there's no aldosterone, potassium goes up. Potassium is up. Yes. There's no steroid. Therefore, your glucose will go down. Hey, glucose is down. Good. Your steroid, the cortisol will decrease. And because you have what? You have no aldosterone and you have hyperkalemia, you're going to push your potassium inside the cell. In the process, you push H plus ion. When you have too much H plus ion, you have an acidosis. It leads to metabolic acidosis, not alkalosis. Therefore, this is an expected finding, expected finding, expected finding, expected finding. No metabolic alkalosis is metabolic acidosis. So that's what you should expect. These are the lab work. Take a picture of it, and I want you to master it. Next generation case study. Don't worry about it. I got you. We've done 20 questions. You're doing well. If you're tired, we'll get some water, but come back. Or take a break and come back to number 20. This is next generation. I'm going to show you Bowtie questions, 2 Bowtie questions to master them. What is it? How do you read it? First 2 sentences. Try to figure out what is going on. A nurse is caring for a client who is 6 hours postpartum. Oh, just delivered. The client is hypotensive, bad problem. Saturating peripart every hour. Bleeding. Client received Pitocin during labor. That means use Pitocin to contract and was titrated to effect. Okay? Tachycardia, 110. Blood pressure is low. Citing 100% non-rebreather. Patient is anxious because they may be in shock. Diaphoretic. Uterus, what is the problem? Is firm, midline, and contracted. That is key. Firm, midline, and contracted. That means the uterus is very small. You look into the perineum, there is no hematoma. Lochia is rubra. What do you think is going on, guys? So what are they asking you? When you read it, you should try to come out. That means postpartum patient is bleeding. The patient is bleeding. But what is the problem? I've given you enough problem that the uterus is normal, contracted. The perineum, there's no laceration. The mommy is bleeding, and it's not febrile either. Therefore, what is growing? Which condition the client most likely experiencing? Uterine atony, retained placenta fragment, infection, or vaginal laceration? Put it down in the comment. But go back to the buzzword and you say, hey, there's no fever. It can be infection. The uterus is firm and midline and contracted. It can be boggy. There's no perineal laceration. It cannot be vaginal laceration. Therefore, this is retained fragment. Retained fragment prevent the uterus from contracting. That's why the mommy is bleeding. If that's the problem, then I got to worry about bleeding. Fundal massage is not going to help because it's not what? It's not going to help because this is not what? Uterine atony. Administer Pitocin, this is not uterine atony. We have to notify the provider and then be prepared to remove the retained fragment. That's a DNC. So this is the way you should think about the questions as you go through. Now, if this is bleeding, well, I'm going to do things about bleeding. Temperature is not going to help me about bleeding. Pain is not going to help me about bleeding. I should check for vitals and lochia. This is the way you do Bowtie. Strategy, it's not that difficult. Just go for the concept. Same thing. Number 2, a newborn has a history of cyanosis. Number 1, blueness. 2, coughing. 3, choking. What? When you do what? When you feed the kid. Cyanosis, coughing, choking. When I feed you, which improves when you cry. But when you cry, all these get better. The next note, excessive secretion. You have too much secretion. Your abdomen is distended. All the vitals are normal. The lung is caused. Heart, there is no heart murmur. That is the key. Peripheral pulses is normal. Patient has no abdominal wall erythema. I've given you everything you need to answer the question. Buzzword, I call it. The nurse has reviewed the clinical data. Which condition should the nurse suspect? Is this tetralogy or folly? Are you going to pick it? Look at this. Is this tracheoesophageal fistula? Is this necrotizing enterocolitis? Is this coarctation of the aorta? I would like to know, question 22, what was your initial diagnosis when I read the case? What came to your mind? I would like to know. But this is the way I want you to break it down. Coarctation of the aorta. The key word is pulses. The upper extremities pulses are different than the lower. I said pulses is normal, eliminated. Necrotizing enterocolitis. The key word is what? Abdominal wall erythema. There is no wall erythema. It's eliminated. If you need more help, I have PGI, a bunch of pediatric information on my website, on your YouTube. You're going to love it with the playlist. So watch it if you're having problem making diagnosis. Tetralogy of Foley. Look, there should be a heart murmur. There's no heart murmur. When they cry, their cyanosis never get better. This guy, the cyanosis get better. Don't get trapped. That's the way. Therefore, it's tracheoesophageal fistula is because they have too much secretion. The esophagus is connected to the trachea. And this is what the problem, like when they take a deep breath, it goes to the esophagus, right? And then the airway, they aspirate. If you put the NG tube here, it's not going to go. So you got to suction them. This is tracheoesophageal fistula. That's the problem we have. If that's the problem, then I got to protect your airway. Blood culture, there's no infection. It's no necrotizing enterocolitis. I don't need to feed you because when I feed you, you're choking, you're turning blue. I got to insert the NG tube. We don't need a colostomy, right? We got to suction your airway because that's the priority information. There's no need for colostomy. You need colostomy for enterocolitis. You need to initiate feed. No, because his kid is going to choke. I'm not going to do that. What am I going to monitor for? Your airway, your airway, your airway. Therefore, oxygen saturation and your work of breathing. You have no heart murmur. I'm not going to worry about it. That's the concept. Number 23. A new nurse is assessing a client who report abdominal pain. I love basic care and comfort, and that's what we have. Statement by the new graduates indicate a need for further teaching. A new nurse is assessing a client who report abdominal pain. Which one need further teaching? And I will ask the client to rate the pain 0 out of 10. I will ensure the client is positioned comfortably before the assessment. I will palpate the area of the greatest pain first to locate the source. I will ask the client what relieves or worsens the pain. What do you think? If you are assessing the patient, concept of assessing pain, do you push where they have the pain right away when you examine them? Of course, ask them about their pain scale. Of course, position them comfortably. But going for the greatest point first is bad. The nurse need further teaching. It's okay to ask them what make the pain better. Therefore, this patient need intervention. Basic care and comfort. And for basic care and comfort, write this down concept. The way to answer the question is in the question. And which nursing action is most appropriate to maintain, what is the word? Skin integrity and prevent complication. So underline that. And then you look at the answer choice. It said it should have what? Skin integrity and prevent complication about no moving. And this is caring for a client with what? Right-sided hemiparesis about stroke. Patient has stroke and it's not moving. How can you protect the skin? Pick an answer choice that is protecting the skin. Massaging the affected area. Is it protecting the skin to ensure increased circulation? Is that what you want to do? Reposition the client every 2 hours and use supporting device. Is that what you want to do? Encourage the client to perform active exercise with the affected limb. What do you think? Keep the affected limb elevated at all times. Which answer choice will you select? Put down in the comment, let me know. Have you locked in your answer choice? I want you to lock in. Lock in really tight. Don't change it. But now let's get to it. Let's break down the answer choice and see what is the right one. I can tell you this is the right answer. Why? Affected limb, elevator all time. He has stroke. That doesn't move. It's not going to help with the skin integrity. Passive active exercise. That leg does not move. He has stroke. It cannot help with that. When you turn them, you support them. Prevent damage to the skin. Affected limb vigorously moving. You should not massage that area. It's a problem. Therefore, we know we're going to turn you to help you with that. This is the way we're going to do it. Same concept, same question, thinking strategy. But why did I say it? That's what the NCLEX will do to you. Use the same concept. Don't change it. And then she's caring for a client with what? Right leg paralysis. That means right leg does not move. Which of the following is appropriate for the right leg? Well, active range of motion, isometric exercise, passive range of motion, isotonic exercise, a bunch of words. You may not know them, but don't stop from there. Don't pick an answer choice and run away. I want you to think about the question and say, I know it. Right leg paralysis. That right leg is not moving. Any answer choice that talk about moving that right leg by the patient is the wrong answer. I don't know isotonic exercise, but it never say patient is not moving. It means patient is doing it. Isometric exercise, patient is still doing it. Active range of motion, patient is doing it. As if patient is not doing anything. Therefore, you are moving the patient leg. I'm picking this answer choice. That's the way you answer questions. That's the way. And I say NCLEX steps always match the type of exercise to the client's level of mobility and volumetry Muscle control. These are adaptant class Q-bank questions. They may be hard, but it's designed to make you pass. And this is caring for a client with what? Right-sided hemiparesis following stroke. Why am I hitting you right there? Bunch of stroke patient, because it's basic care and comfort, and that's the patient you will see. That's the patient the NCLEX will ask you. Which nursing action should the nurse prioritize to prevent misuse? As you can see, all the three questions are saying the same thing, different language, but you're using the same concept. This is asking you about disuse syndrome. Encourage the client to verbalize their feeling of frustration. Perform passive and active range of motion exercise to the affected extremities. Reposition the client every 4 hours. Apply compression stocking to the affected leg. What's the problem? Patient and stroke, we want to do something to prevent disuse because they're not using it. Therefore, we want them to use that extremities that is affected so that it does not lead to disuse, contraction. You see that the three questions saying the same thing, but different wording. Use that idea. When you see questions, go for the concept. Disuse means I want them to move it now. Encourage the client to verbalize feeling. It's not talking about movement. Passive range and active range exercise to affect the extremities, forcing them to see if they can move, at the same time moving for them. Reposition them is not moving. Apply compression stocking, you are not moving it. You see the way I'm picking this. So watch these three questions, mark them so that next time you see them, you know what to do. Which finding most strongly indicate the client experiencing big discomfort, best care and comfort. Therefore, anything that will cause pain is discomfort. And then she's providing care for a hospitalized client who is unable to verbalize. He can't say anything that is in pain due to stroke. He can't talk. How would you know the patient is in pain? Check the blood pressure of 128/76, period of rest with eye closed, facial grimacing and guarding, and what? Oxygen saturation of 95. Which one tells you patient is in pain? The blood pressure is normal. It's not going to tell me. When they're resting, they close their eyes. It does not mean anything. But when a facial expression changes, I'm worried about it. And this is caring for a post-op client who report what? Generalized discomfort and restlessness. The client vitals is normal, stable. Surgical incision is clean and dry. Which nursing action best promotes comfort? Same thing, comfort, right? He just had surgery. His vitals is normal. He has generalized discomfort and his restlessness. Does he need pain medication? You check the incision, it's fine. Why? Encourage the client to walk. The patient is in pain. Reposition the client, provide additional pillows. Does that provide comfort? Obtain complete pain assessment using numerical scale. Patient is in pain right now. Notify the provider of inadequate pain control. Which one will provide best comfort for this patient at this point? His vitals is normal. His surgical incision is clean and dry. Nothing is moving. If you let them walk, it's not going to help. When you reposition them, it's a comfort. They may have better pain control just by repositioning before you even do a full assessment to figure out what is going on. Calling the doctor is not going to help. There's nothing telling you they have inadequate pain. Basic care and comfort intervention, such as repositioning and support, should be attempted first when pain is mild and non-specific. I put this question in the community chat, and the score was very low. Why? It's our concept. Based on the description, the nurse should identify the pain as what? And nurse is assessing the client with what? Discomfort, right? The client described the pain as what? The pain is diffuse, pressure-like, and difficult to localize. Look, those are the buzzwords. Circle it and then use it to look at each answer. Don't jump the question and the answer selection. Don't do that. It does not help you. You may make a mistake. I've described a quality of pain and ask yourself, hey, what kind of pain is that? And you see referred. Referred means it's moving from one place to another. There's nothing in the question that says Something is moving from one place, it's gone. Neuropathic pain, the word is burning. There is nothing burning here. Somatic is sharp and localized. This is not difficult to localize. You see the buzzword. This is visceral pain. That is the way you answer questions. Best care, basic care, and comfort type of question. The next teaches the client about sleep. Of course, it's calming. Sleep and fall, mobility. That's why I spend time on these areas. They will show up. Which instructions should the nurse include? Sleeping. Well, if you want to sleep, do you maintain a constant bedtime? Do you avoid caffeine after noon? Do you use electronic device before you go to bed? Do you reserve the bed for sleep only? And do you engage in vigorous exercise before bedtime? Stop the video, put down your answer, lock in your answer choice, and then I will come in and give you explanation. And I can tell you, number one is good. A, consistent, your body get used to it. Caffeine, you're not going to sleep. If you avoid it, it's good. Use electronic device before going to bed is not good. You're not going to sleep. You stay on it and you pass your bedtime. Don't use it. Reserve the bed only for sleep. When you're ready, go lay down. Exercise should be far away, 4 hours minimum before you go to sleep. Therefore, this is not good. A client with what? COPD. I love this portion of it. I've taken you to another section, right? What do you think we're doing now? Respiratory. Today, I want to talk about more respiratory. It's a key concept to know. That these fall under what? Physiological adaptation. A client with, so this is respiratory system. A client with COPD exacerbation has oxygen saturation 65. Which intervention should the nurse prioritize? Prepare for intubation. Apply non-rebreather oxygen. Initiate high flow oxygen. Initiate non-invasive positive pressure ventilation. BiPAP, a bunch of them. But what is the problem? You don't need to know the answer choice before you pick it. Look at it. What is the key? The patient has what? COPD. When COPD saturation is going down and they're having exacerbation, what is their problem? It's CO2, not because of oxygen. And therefore, blow out the CO2. Blow off the CO2. If you intubate them, you give them too much oxygen. If you give them non-rebreather, you give them too much oxygen. If you apply high flow oxygen, too much oxygen, you take away their drive. But what do you need? You need to give them BiPAP. BiPAP will blow away the CO2. And then before you give them oxygen. This is a concept I want you to know. This is what you need. BiPAP improve ventilation and oxygenation while avoiding intubation. High oxygen can suppress respiratory drive in the COPD. That's the concept. Master them. What do you think? A client is admitted with what? Severe pneumonia infection due to what? Mycoplasma pneumonia. Which prescription should the nurse implement in order? I have pneumonia infection. Do we start with IVR fluid? Do we give them IV antibiotic? Do we give them sputum culture or oxygen? Think about it. Arrange them and let me know. Put it in the comments. 32. Arrange them. Hashtag 32. But this is the way. Pneumonia. What is the major problem? It's an infection. In the patient who has pneumonia, is going to have oxygen issue. Give them oxygen. Then what? We draw culture. After the culture, we give them antibiotic. And then we give them fluid. This is the way it's supposed to be. And that's based on the concept associated with that. So that's what you have. Same thing. A nurse is caring for a 5-month-old infant diagnosed with what? Croup, respiratory, croup. Bad problem. You have tracheobronchitis infection. Which assessment finding require intervention? That means B-sharp movement. What is that? Is there anything that you worry about? Does croup patient have mild strata at rest? Does croup patient has hoarseness? Does croup patient has grunting? Does croup patient has backing cough? That's what they mean when you see prioritization. All these are bad problems. But which one is the number one? Well, they have stridor, so I'm not worried about it. They may have some hoarseness. I'm not worried about it. But when you're grunting, That's respiratory failure. Backing cough, expected finding. This is the way you should do this kind of question. Ask yourself, what content do I know? And what is an expected finding? If it is, I ignore it because all of these answer choice can be right. But number one is granting. It means impending respiratory failure. That's how you master this. Which findings are consistent with obstructive sleep apnea? You have to know this. How do you know this? Constant information about specific problem. Sleep apnea, well, do they have loud snoring? Do they have headaches? Do they have daytime sleepiness? Do they have bradycardia during sleep? And do they have witness apneic episode? It's obstructive sleep apnea. Therefore, something is going to obstruct you. Apnea, you're going to stop breathing. If you don't sleep at night, you're going to sleep during the day. If you have obstruction, you're going to have loud snoring. And if you don't sleep at night, when you wake up, morning sleepiness. But because you've been waking up at night, you have tachycardia during sleep. You see, this is the way it goes, man. Number 36. After reviewing morning laboratory results, a nurse recognized that a client ABG indicate which acid-base imbalance. What do you think? Which acid-base imbalance after all this? Which acid-base imbalance? We have a pH of 7.3, PCO2 28, and bicarb of 15. Is this metabolic acidosis with respiratory alkalosis compensation? Is this metabolic alkalosis with respiratory acidosis? Is this respiratory acidosis and metabolic compensation? Is this mixed metabolic and respiratory acidosis? How do you approach your ABG? The way I do it, look at my pH. It's abnormal. It's less than 7.4. Therefore, it has to be an acid. And therefore, the first one, I'm looking at it. Metabolic acidosis. I see alkalosis. I already canceled it. Respiratory, there's acidosis here. This is gone. Now, what is responsible for the acid? Is it bicarb or CO2? If bicarbonate is responsible for the acid, it's going to go down. It has gone down. If CO2 is responsible for the acidosis, it's going to go up. It has gone down. Therefore, it's not respiratory, it's what? Metabolic. Therefore, this is gone. Now you're left with this two alone. But then why is this right? Respiratory compensation. Well, if you have metabolic acidosis, your compensation is going to be respiratory because you want to blow out the acid. And therefore, that's why this has gone down. This is metabolic acidosis, respiratory alkalosis, compensation. This is the way you should do them. If you need more ABG, check out Dr. NCLEX, and then you will master them in nursing school or NCLEX. And then provide safety teaching to a client of a 4-year-old. We're doing safety now. You see, we're moving. Done fundamentals. So fundamental safety, fundamentals of safety. That's where we are right now. I'll make sure all medication are stored in the log cabinet. Which statement by the parent indicate need for further follow-up? 4-year-old. My child knows how to swim, so I let him play in the pool while I step inside briefly. We use a forward-facing car seat with harness. I keep all cleaning product out of reach. Which of these in a 4-year-old house should you intervene? What do you think? Put down your answer. Let me know. I will make sure all medication are stored in the log cabinet. It's a safety issue that has been achieved. If you walk away because your kid can swim, he's going to drown. Forward-facing for a 4-year-old is acceptable. Or cleaning product is out of reach. That's good. Number 2, bad safety. Which action by the nurse require intervention by the child nurse? Select or apply. This is NCLEX SATA, like I told you. Select or apply. I want you to be comfortable with select or apply. So that's why most of this is select or apply. 5 clients are using assistive device who require intervention. That means they're not doing well. Demonstrating 2-point gait with their cane Is that what you need to do? Ensuring the walker height aligned with their wrist crease. Allowing a client to pull on the walker to stand. Do you think it's okay? Teaching a client with the leg cast to use crutches with 3 points. Lower the foot plate after transfer to a wheelchair. Which of this is okay and which one we need to intervene? What do you think? 2 points down for cane is acceptable. Good, we don't need to intervene. Ensuring a walker height aligned with the client's wrist is acceptable. We don't need to intervene. Therefore, those two are gone. Allowing a client to pull on the walker to stand will let them fall. They should push so that they can put pressure on it. This is a problem. If you have a cast on and the crutches, you're supposed to stand in the 3 point. And then when you transfer a patient to a wheelchair, you're supposed to lower the foot plate so that they can step on it. Before transfer, you should pull the foot plate away. After you transfer, you put it back so that they can step on it. One answer choice. If you overselect, you get 0. This is the way I said it so that you can master it. And then she recommended an occupational therapy referral for which client? Who need occupational therapy? Concept, you need to use your hands below your elbow. So anything below your elbow is occupational therapy. Client relearning to walk after hip fracture, client with expressive aphasia, client struggling to dress after a stroke, client with chronic back pain needing exercise. Back pain needing exercise, you're a physical therapy. Struggling to use dress after a stroke, you can't use your hands. Expressive aphasia, that's your mouth. Relearning to walk, that's your walker. Using a walker, that's basically you using what? Your physical strength, and that is physical therapy. Therefore, dressing yourself is a fine motor skills that require occupational therapy. A nurse is caring for a neutropenic client receiving chemotherapy. Which actions require intervention? Some of these questions you can anticipate. You hear the word neutropenic. What do you think? Prevent infection, prevent infection, prevent infection. Which answer choice is preventing infection? Look at it. Client placed in a private room with the positive airflow. Visitors wear masks and perform hand hygiene. A small potted plant is placed in the room. Client is served a hot dog sandwich. Prophylactic antibiotic are prescribed. Which one is going to prevent infection? Put down in the comments your answer choice. Let me know. Which one would you pick? But these are concepts I want you to know. Like I keep on saying, I want you to take a pen and paper. When you spend time watching this video, by the time you finish, you say, oh, I learned everything I need to know so that you can go over it. And what is that? We need to place this patient in a positive airflow. That means positive airflow means air from outside is not coming into the room. It's different from negative airflow, where air from inside leaves to the outside to a specialized place. The questions here require intervention. This is good. Client wear masks and perform hand hygiene. Visitors wear masks and perform hand hygiene. That's good. A small potted plant is placed in the room. We don't need it. Client is served an hot dog sandwich. Is going to get sick, raw food. Antibiotic may be needed. So that's what we need. Those are all interventions. And this is preparing a sterile field. Place the step in the correct order. Perform hand hygiene. Select a clean surface above your waist. Open outer package away from the body. Remove inner sterile kit. Apply sterile gloves. These NCLEX practice question, NCLEX review question, NCLEX questions and answers for RN and LPN are trying to put a lot of fundamentals to make you more comfortable. They may look hard, but the time you finish, you say, I learned something about sterile technique. That's all. I'm not trying to trap you, but I want you to benefit from this after watching it. What's the first thing will you do if I give you this to arrange? You are on the ward. I said, do this for me. Sterile technique. What are you going to do? Arrange them yourself and let me know. Put it down in the comment. I'll look for them. But every time you got to perform an hygiene, right? And then you select the place where you want to create your sterile place, and then it should be above your waist so that it doesn't get contaminated. Then you got to open your product, open the package before you go to the inner one, the outside before the inner. And don't forget, sterile gloves is the last thing you do. Therefore, this is the way it's supposed to be. And next, attend staff education program about what? Surgical asepsis. You can see we're getting to infectious control slowly. We're getting there slowly, but you can see that's what I'm trying to get you. This is our safety, but we'll get to infectious control. Which statement indicate correct understanding? Select or apply. Surgical asepsis. What are the components of surgical asepsis? Please write this down because this is classic NCLEX question, classic nursing school exam question. You have to know surgical asepsis. Sterile item may touch each clean object. Do you think you have a sterile object touching a clean object? Is that possible? A sterile field must remain above your waist. You see the question we saw before, select or apply? Yes, this is application. Sterile object can be exposed to air indefinitely, and moisture contaminate a sterile field. Is that true? The outer 1 inch or 2.5 of the sterile field is contaminated. What do you think? This is something, if I were you, I would take a picture. When you see your question, these are the terms they will use to trap you. I can tell you this is true. And moisture will going to contaminate it, the surgical field. A sterile object should not touch a clean object. And a sterile field should be above your waist. Of course, air can affect it. So those are the surgical asepsis information. A client receiving enteral feeding developed diarrhea. This is my favorite question. My favorite question, critical thinking question. The client has no abdominal pain or distension, but the heart rate is elevated. What is the nurse priority action? Stop the feeding immediately, check urine output, give them anti-diarrhea medication, slow the feeding rate. What do you think? Client receiving enteral feeding develop diarrhea. Well, if you're developing diarrhea, there's something going on here. Pick your answer down and then listen to the way I'm going to approach it. What do you think? He has no abdominal pain, he or she, and no distension, but the heart rate is elevated. Diarrhea, elevated heart rate means dehydration from the feeding itself. Therefore, what do you want to do? Do you stop the feeding? Do you check the urine output? Do you give them anti-diarrhea medication or slow the feeding rate? This is a test-taking strategy. Diarrhea, elevated heart rate, would suspect probably what? Dehydration. Confirm it. Check their urine output. If their urine output is low, you have your answer. You say, oh, patient is dehydrated. We need to change the tube feed to something that is isotonic, and that will be responsible for that. And this is the key. Diarrhea, tachycardia suggests dehydration. Assess the fluid volume status before initiating therapy. You need to do your assessment. A hard one. For which client should the nurse recommend the use of restraint? Who need restraint? Concept you need to know and write that down. How do I apply this restraint? Which patient needs restraint? That's what the NCLEX is going to ask you. And let's become aware of several clients. They're going to ask you about restraint. Who should you give restraint? What are the indications for restraint? The confused client attempting to pull out the what? Endotracheal tube. The client receiving enteral feed tube who has diarrhea. The client pacing in the hallway due to anxiety. The client refusing prescribed medication. Who need what? Restraint. What do you think? Concept. If you're going to cause harm to the patient, cause harm to yourself, or affect treatment, we're going to restrain you temporarily. Refusing prescription, you're not going to affect anybody. That's your problem. Walking on your own way, pacing, I'm not affecting anybody. I'm not going to be harming anybody. It's me, my problem. You're having diarrhea. There's no need to restrain you. There's other things you can do. Patient is confused, attempting to pull out endotracheal tube. When they pull it out, that's emergency, airway emergency. This patient needs to be restrained. And this is caring for a newborn in a postpartum unit. We are in a newborn. If you have problem with newborn, Adaptation is in home of maternity, content simplicity, and newborn. A bunch of videos that can make this topic easy, which action are appropriate to prevent newborn abduction. What do you think? I don't want you to get lost. I don't want nobody to steal the baby. What would you do? Verify identification of the staff members entering the room. Wear the nurse photo ID badge at all times. Advise the mother to post the newborn picture on social media for recognition. Ensure newborn is never left alone. Match maternal and newborn identification band every handoff. Allow the newborn to stay at the nursing station with that staff present. Some of the answers are straightforward. It's just testing your knowledge. It is what it is. Don't overthink it. Which one is very helpful? That's all. If you overthink it and you say, oh, am I trapping you? No. Verification is good. We got to wear our ID. Don't post pictures on the social media. The baby is not going to be left alone, no matter what, whether you like it or not. We're going to be with the baby. Make sure everything matches. And the newborn is not staying at the nursing station alone. That's the key. That's how you avoid abduction. A 1-week-old infant has what? Machinery like mama and tachycardia or tachypnea. Which intervention should the nurse anticipate? Immediate surgical repair, place the newborn in knee chest position, a prescription for NSAID, a skin-to-skin contact with the mother. What do you think? This is a concept you have to know. But what concept are you worried about? Is machine-like mama. What is that? This is PDA. Baby has a PDA, is 1 week old. What do? Do you repair it surgically? Do you put it at the knee to chest position? Give them NSAID, give it to the mommy for skin to skin. It's a concept. I know you know it because you watch Adaptation class. What are you going to put down? Prove to me that you master the concept on pediatric congenital heart disease. I know you know it because I can tell you're picking the right answer if you use the concept. But what do you think? PDA, we need to close it. What's closest PDA? NSAIDs. Do you see any NSAIDs here? Of course, yeah. I know you never picked the Thyroidectomy because the mama that's not consistent with the Thyroidectomy. That's how you put in the knee to chest position. It's machine-like mama. It's not knee to chest position. This is what machine-like mama, we have to give the patient NSAID. A newborn diagnosed with what? Tracheoesophageal fistula. We saw the concept on the case study. Is being prepared for surgery. You know the problem, the pathophysiology. Which perioperative intervention should the nurse initiate, select, and apply? I told you SATA and prioritization is all these videos about. Based on that so that you can be comfortable. A bunch of SATA. But what is the key? Tracheoesophageal fistula. We got to protect the airway and we need surgery. Give the NPO, elevate out of the bed, suction the baby, oxygen supply, give them nutrition, give them antibiotic. What do you think? Another concept, don't over-select. You don't need to pick all the 6 questions over there, answers over there. Pick those you're confident. But you know the baby cannot eat anymore because they have esophageal fistula, so NPO. If I'm NPO, I need some nutrition. I'm going to have surgery, I need antibiotic. And because you have secretion, I need to suction out. And since you are at risk of aspiration, your head is up. Of course, everybody needs oxygen. You see the word I did? Concept, strategy to answer questions. This is Adapting class. Thank you for watching. You are on 47 questions. You made it so far. Thank you for staying. And if this video is helping you learn some concept, look down, you see Adapting class, click on it, subscribe for more content like this, or put a small comment or like them in this video, because that's the only way YouTube will share to other people. Engagement. So put down some comments so that we can grow this channel, so that you can get more content I will make for you and YouTube will show it to you. So that's the answer choice. After delivery of a newborn, baby is born. Prioritization, okay. Which prescription should the nurse prioritize first? Prioritization. Remember we did prioritization. I separate the OB and the newborn, I put it where they are. What do you think? Erythromycin ointment, vitamin K injection, a B vaccine, or skin to skin? Baby is just born. Which one we do prioritize first? Always safety and thermoregulation before everything else. It's a bunch of medication. Why will eye drop be better than vitamin K? I know I need to give them vitamin K. I know I need to give them eye drop. I know they need vaccination, but hey, close to mommy to warm them up is much, much better. That's the key. A nurse is assessing several clients postpartum. They just had baby. Which finding demonstrate facilitating what? Behavior to parenthood. Which what? Behavior. What do you think? Facilitating behavior to parenthood. If you don't understand, look at it. It means they're coping, they're ready to move on to be a mommy. So that's facilitating behavior, adaptation to having a baby. Which statement indicate that? Once again, NCLEX set that question for the NCLEX. That's what it is. States the newborn look like her. That's what the mommy is saying. Calls the newborn by the name. Oh, he kisses the newborn frequently. Smile at the newborn. States she is comfortable allowing the baby to cry and prefer the newborn remain in the nursery. Which one indicate facilitating behavior? That's the question. What do you think? Let me know. A, baby look like me, I'm adapting and look good. Call the baby by the name as adapted. Recognize the baby is part of the family and kisses the baby too. You smile at the baby. Oh, awesome. State she is comfortable allowing the baby to cry. It's okay, right? What do you think? It's a tricky one. It's okay for the baby to cry. No, she's not basically adapting that well. Baby, you can cry. I don't care. No, they need to show some love. Prefer the newborn to remain in the nursery. Keep the baby there. I don't like it. This two, I don't like it. 1 and 4, 1 to 4, and the best one, indicating the facilitating behavior. You've done 50 questions. You're on 51. Thank you for staying. How are you doing? If you need something to drink, go and get it. But this questions is going to get we're going to get to pharmacology. We're going to get more information, and I want you to be comfortable answering them. So go get something and come back. But which action should the nurse prioritize? Prioritization 101. A client with what? Foley catheter reports suprapubic pain, dysuria, and fever. Which one would you prioritize? Irrigate the Foley to remove the debris, obtain a urine culture, replace the Foley catheter, increase oral fluid intake. What do you think? Patient is having fever, dysuria, and suprapubic pain, and they have what? Foley catheter. This is catheter-associated Foley catheter, intrauterine catheter. And therefore, what do you want to do? You need to do something. Prioritization 101. Put down your answer and let me know. Like I told you, this video based on a bunch of prioritization and most tested concept, nursing concept you will see. What do you think? Irrigating is not going to help you. Obtaining culture, so you figure out what is going on before you remove the Foley catheter. Then you can give them fluid. So obtain culture is number one. Now, infectious control, my favorite. Is that your favorite? Don't worry, I got you. And this is caring for several clients. Drag the correct transmission-based precaution. Transmission-based precaution infectious control key to match each client condition. We have client A, he has rubella, B, he has rubella, C has what? RSV, D has disseminated zoster. What do you think? A, rubella is a droplet. Therefore, I'm going to match you with droplet. B, rubella. What do you think? This is airborne. Therefore, I see airborne N95. RSV is contact and droplet. Therefore, you go here. And you have zosters that is gone everywhere. You have both contact and airborne. This is the way you do it. If you need more with infectious control, check Adaptation class for more content like that. The next enters the client room requiring what? Gloves, mask, gown, and goggles. Which is the correct order? So how are you going to wear it? Which one you wear first? The way I think about it is like getting out of your house. The first thing you do, you put on your dress, right? You put on your dress. After you put on your dress, well, you got to wash your face, clean your face, and then make up your face, right? Then you may put on your glasses or something like that. Then you take your keys. Therefore, I need to wear my gown, wear my mask, then put my goggles on, and then take my keys. That's your gloves. That's the way you think about it. And the opposite is when you get home. That's what you do. The correct understanding of what standard precaution is shown when the nurse is observed. What? What do you think? Standard precaution. Which one means standard? We all do standard precaution. Which one? Using alcohol-based rub when hands are visibly soiled. Do you use alcohol when your hands are visibly soiled? Performing hand hygiene before entering and after client contact. Using alcohol-based rub after removing gloves. Wearing double gloves for a client with HIV. Wearing gloves, masks, eye protection when splash risks exist. What would you choose? What is your priority? Which one do you think you should worry about? Well, if your hand is visibly soiled, you should not use what? Alcohol. Just wash your hands, soap and water. Of course, everybody, we got to perform hand hygiene. When you use alcohol or soap and water, it does not matter. Then when you remove your gloves, you can use alcohol. HIV patient, you don't need to double gloves because they are standard precaution. And if there's a splashed risk, you can wear gown, mask, and eye protection. That's all, standard precaution. Easy. Which room assignment indicate correct understanding of an infectious control? That means the same organism, not the precaution. The name has to be the same, not the precaution. Not contact, but it should be what? Episimplest, episimplest. Scabies and C. diff, they are not the same name. HIV, MRSA, not the same name. MRSA will infect HIV. VRE and ESBL, not the same. Small bowel obstruction, upper GI, none of them have infection. Therefore, pick this one. Is the critical thinking. I trap you, right? No, critical thinking. I'm using the same concept and I get to 4. None of them have infection. Hey, they can be put together. That's all. Which action demonstrate correct understanding of infectious control precautions? Transmission-based precaution. Which one indicate understanding? You wear a surgical mask for a client with pertussis. What do you think is pertussis? What kind of transmission-based precaution do you need? Wear a surgical mask for Kawasaki disease. Keep the door closed for latent TB. Use alcohol-based sanitizer after caring for a client with retrovirus. Placing a client with diphtheria in a negative pressure room. Let me know what you pick down in the comment for 56 infectious control transmission based for this particular question. This is testing your critical thinking and how to answer question without not jumping the gun. It's a select or apply NCLEX sector question. Which one indicate correct understanding? I give you a few more seconds. What do you think? What do you think? Wearing a surgical mask for pathosis? Yeah, because it's droplet. Wearing a surgical mask for Kawasaki. Kawasaki is a standard precaution. You don't need to wear anything. Keeping the door closed for latent TB. Latent TB is standard precaution. You don't need to keep the door closed. Then using alcohol-based sanitizer after caring for patient with rotavirus. You need what? Wash your hands, soap and water. And diphtheria does not need negative pressure because it's droplets. Only one answer choice. If you over-select, you get 0. That's what the NCLEX will test you. Key concept, this one, it's a little bit harder, infectious control, but it requires you to bring all your content. This is the same thing. Correct understanding of infectious control is demonstrated when the nurse institutes standard precaution for a client with which condition. Which one needs standard precaution? Patient has what? Vesicular rash, 2, molar rash, bullseye rash, erythematous rash with pruritus at the elbow, rash after a nickel placed on the skin. What do you think? Let me know in the comment which one you're going to choose. That indicates that you understand this one. What do you think? This is contact dermatitis, standard precaution. Erythema rash with pruritus at the elbow. This is atopic dermatitis. Bullseye, Lyme disease is our standard precaution. Molar rash is what? Systemic lupus. Vesicular rash is a bad problem. Infectious. Varicella. And this is assessing a client with what? Systemic lupus. Now we are in the risk reduction. We are finished with infectious control. How did you do? Now we are on risk reduction. We got to reduce risks because this is the areas most people have problem with. They fail the NCLEX because of this one of these areas. Therefore, let me show you some of the key concepts. Systemic lupus. Find things that you would do to prevent risks. Which finding are expected? Expected finding in patient with the systemic lupus. And then it's assessing patient with what? Systemic lupus erythematous. Butterfly rash on the face, fatigue and malaise, hematuria and elevated creatinine, joint pain and stiffness, and shortness of breath with chest pain. I will show you strategy. You know it's a musculoskeletal problem with systemic lupus. That's the major one with skin manifestation, but it affects all organs. Because of that, he has some rash. This is an expected finding. Fatigue and malaise is not specific, so that's okay. But when your other organs are affected, you have blood in your urine, creatinine is high, this is nephropathy. Lupus nephropathy is bad. Joint pain and stiffness is a musculoskeletal problem, right? Rheumatoid disease, therefore that's fine. Shortness of breath and chest pain, that means you have pericarditis and pruritus, carditis. These are all complications from systemic lupus. So those are not expected finding, bad complication. And this is reviewing laboratory results on a client with systemic lupus. I want you to give you more content regarding that. Which findings should the name prioritize? Based on what I told you, if you see something affecting other organs, it's a problem. Positive antinuclear antibody. That is the diagnosis of lupus. Elevated erythrocyte sediment rate. It means inflammatory reaction due to rheumatoid problem. Hemoglobin 11.45 is not that low. Proteinuria in urine analysis, that means you have kidney issue. You have to pick this one, right? Your kidney is affected. Those lab work are consistent with what ANA and ESR are consistent with the disease. And hemoglobin, you may have anemia, but 11.5 is okay. But when it's protein, your kidney is damaged. We pick that one. And this is primary care for a patient with what? Symptomatic aortic stenosis. That means the aorta is blocked and they're going to have problems. So when you draw it, the outflow is obstructed, outflow. When the ventricle pump, blood is not coming out. Which intervention should the nurse include in the plan of care? That is risk reduction, so that the patient does not die. What is the major side effect or complication of aortic stenosis? Sudden death. Therefore, monitor for exertional chest pain, encourage vigorous ambulation, maintain adequate preload, monitor for syncope, administer diuresis aggressively, prepare client for possible valve replacement. The best thing is to relax the ventricle and let it push out more blood, improve cardiac output, and improve preload. So which one is going to improve cardiac output and preload? What do you think? You got to monitor for exertional chest pain. That's what kills them. When they exert themselves, they die. They should not do vigorous ambulation. That's bad. Maintain adequate preload, more preload so that you can improve cardiac output. I told you, syncope, exertional chest pain is their problem. If you give them diuresis, you lower their preload. That's not good. They may need valve replacement. So that's the things you need. A, C, D, and F are your right answer. Those are the conditions that you have to institute. The client reports sudden onset of right eye pain. There is a pain, number one. Photophobia, another pain. Redness is injected. Scotomas, they're seeing stars. Which diagnosis is most likely? Is it cataract, retinal detachment, acute angle glaucoma, and macular degeneration? These vision high questions are usually straightforward if you go for the buzzword. I see pain and I come back and I say, which one would you choose? Put your answer in the comment. I give you 5 seconds. Let me know what you think. But I will tell you the answer. But I'm not going to give you right away because I got to explain to you so that it makes sense to you. What do you think? I see pain. People walk around with cataract. It doesn't hurt. Macular degeneration has no pain. The two that has pain is that. But retinal detachment, they have to tell you about their vision field. They feel like curtain falling on their eyes. It doesn't say here. Therefore, acute angle glaucoma. This is the way when they ask you about diagnosis, that's the way you approach it. When you need more, email me. I'll show you. I call them buzzwords. You look at the question and you look for the buzzword and you connect the dot. If you do that, case studies, next generation case studies are babies. You hate them because you understand how the words are coming together. What do you think? And my client is appropriate for transfer. This is management of care. Management of care, this is a portion, I separate this one. Which client is appropriate for transfer from ICU to the medical surgical unit? Patient is 2 days post-op cardiac catheterization, right? And he's enlarging groin hematoma. Should this patient go to the floor? 2 days post-parathyroidectomy, they remove parathyroid and he has positive T signs, like I told you. 2 days post-ischemic stroke with expressive aphasia. He's still talking with having issue with expression. 2 days with what? SVT, now control on amiodarone infusion. Who is ready to go? Who do you think is ready to go? If you have SVT and you're on amiodarone, you can go to the floor. If you have stroke 2 days, you have expressive aphasia, you're stable, basically completely stable. Your aphasia is not going to go away right away. If you have parathyroidectomy, you still have signs of hypocalcemia, you are not ready to go. And you have cardiac catheterization, and you have hematoma, you're bleeding. This patient is the one we can transfer. That's the concept. Number 63, almost there. And nurse is planning a staff education program about client confidentiality. This is management of care, some ethics, legality, which action violate client confidentiality. You're doing something bad. You're showing things to people that they're not supposed to know. Which one? Discussing a client diagnosis in the elevator, leaving the client's chart open at the nursing station, faxing medical record with the cover sheet, posting about the client on social media with that identifying information, Sharing client information with the nurse not assigned to the client. Confidentiality. You are not responsible for the care of the patient, but you hearing about it. Select or apply. Discussing the client diagnosis in elevator, bad problem. Leaving the client chart open at the nursing station, bad problem. Faxing the medical record with the cover sheet is good because then nobody can see it. Posting about the client on social media without identifying information still is a problem. You are violating their privacy. Sharing information to somebody who does not care about the patient. Yeah. So these people, they are in trouble. We got to fix them. Violation, HIPAA violation. So public space violate HIPAA. Chat must be secured. Social media posts are prohibited. Even without the name, it should not. Staff must have a need to know information. C is appropriate because they cover it with the cover sheet. And this is present with the provider obtain informed consent from a client. Which elements are required for informed consent? Once again, a nurse is present while a provider obtains informed consent from a client. Which elements are required for informed consent? The word is informed, so you got to inform the patient. Select and apply. SATA, like I told you, a bunch of SATA. Explanation of the procedure, risks and benefit, alternatives to the procedure, assurance of a positive outcome, client's right to refuse. If you have to obtain consent, which one should you include? Do you have the explanation of the procedure? Yes. The benefit? Yes. Alternative? Yes. You should not assure that it's going to be positive outcome because complication will happen. It's not part of the informed consent. And the client can refuse. Those are the things you include. And this is calculating a client total intake for the shift. Which item should be included? Total intake. When you see questions about intake, the buzzword is if you can pour it, is good. And if it's a liquid, it can melt, is good. Otherwise, anything you cannot pour it, you can pick it. Coffee, I can pour it. Soup, bowl of soup, I can pour it. Gelatin can melt, right? Ice chips can melt. Mashed potato, negative. Popsicle will melt. Applesauce, puree, I can still pour it. So this you should include in the liquid calculation. So don't forget it. When they give you a calculation, you should include this one. And this is reviewing prescription for a client. Pharmacology. That's my favorite. Pharmacology. Are you ready for hard-hitting pharmacology? Giving you concept. I want you to write them down. And this is reviewing prescription for a client. Which medication combination require immediate intervention? When you see it, that means they cannot come together. Either there's a problem. And you got to remember how to find the medication, and then you can figure out. Fluvoxamine, what does this medication? And then now prescribe tramadol for knee pain. He's taking that. Patient is taking lithium for bipolar. Can you do that? Bupropion is prescribed for smoking cessation. Is that acceptable? Fluoxetine is prescribed for depression, and the patient also has anorexia. Triacylphenidal is prescribed while the client is taking allopurinol. Is they acceptable? What do you think? Break it down. Select and apply. Don't overselect. Fluvoxamine is what? SSRI. Tramadol is also serotonin. The two can cause serotonin syndrome. Lithium can be used for bipolar. Bupropion can be used for smoking cessation. Fluoxetine can treat depression and is good for anorexia. Triacylphenidal is what? Anticholinergic. You use it for patients with allopurinol. Therefore, the only patient is number one. Only one answer choice is the right answer. And that's what? Number one. Watch for this kind of concept to master them. Okay? And then prepare to administer scopolamine to a client with a motion sickness. Which client history is contraindicated, right? History of irritable bowel syndrome, drooling due to secretion, history of glaucoma, history of edge incontinence. For patient history and prescribe scopolamine. Break it down. We're using scopolamine for motion sickness. But what is the major side effect? It's an anticholinergic. Who cannot take anticholinergic? Irritable bowel syndrome, we give them anticholinergic. It's good. Drooling, we got to stop secretion, anticholinergic. Glaucoma, hate anticholinergic. Urge incontinence, you give them anticholinergic. Therefore, which one we should intervene? Glaucoma. A nurse prepared to administer isosorbide mononitrate is a nitrate. Which finding should the nurse hold? Which finding should cause the nurse to hold the medication? What do you think? Blood pressure 120/70, flushed skin, and a history of heart failure, or receiving nitroglycerin. This is a nitrate. You cannot combine nitrate. If I give you nitrate, your blood pressure goes down. Isosorbide, blood pressure is fine. You're going to have flushed skin because your vein get bigger. It's used for heart failure. That's why we use it for. You cannot take any more nitrate. Therefore, this we got to intervene. And nurse teaches the client receiving long-term ibuprofen therapy for osteoarthritis, which statement indicate correct understanding. NSAID teaching. That's all. I will take this medication with food to protect my stomach. Is that right? I can drink alcohol as long as I don't exceed 1 drink per day. Is it okay? I should stop the medication if my joint still hurt. Would you do that? I can take this on an empty stomach for a faster relief. NSAID causes ulcer. What is the right answer? Number 1. This is the best answer, correct understanding. You should not take it on an empty stomach. You get ulcers. You should not stop it because your joint still hurt. It's going to help you. It's a long-term therapy. Alcohol causes ulceration. If you take that, it's going to be bad. Take it with food to protect yourself. And then it's reviewing antibiotic safety with new staff members, right? Which parent demonstrate correct understanding of antibiotic precaution? This question, I want you to take a picture. I gave it to you so that you can master it. When you see a question anymore, remember this slide. Once again, remember this slide. Take a picture. Which parent is appropriate? Sulfonamide. Do you tell them to avoid sunlight? Cephalexin. Do you check for penicillin allergy? Ciprofloxacin. Do you check for tendon rupture? Tetracycline. Do you avoid it in pregnancy and confirm status? Vancomycin. Do you avoid Redman syndrome and run it up to 60 minutes? Azithromycin. Do you avoid cardiac what? Ensure cardiac monitoring to prevent QT prolongation. What do you think? Put it down in the comment. You don't have to pick everything. It's just select and apply. Those that you are 100% confident, 101, put it down in the comment and pick them. Now, I can tell you all of them are right. So these are all classic antibiotic signs and symptoms. So take a picture next time. Adaptation Class got you. This is Adaptation Class Q Bank. If you want more, you can join our Adaptation Class membership. Not for the Q Bank, but for the Q Bank, you have to go to on demand. We have on demand check Adaptation Class on demand, and you get it. You get access to that. So this is a build up of that. Now I flip it. I give you wrong information, and I want you to pair them the appropriate way. Which teaching points should the nurse include? That means they got to include appropriately. A nurse is conducting staff education program on antibiotics. Select and apply. Which one is appropriate? Sulfonamide. Do you monitor for QT prolongation? Is that right, Perry? Sulfasalazine, right. Obtain pregnancy tests. Ciprofloxacin. Do you worry about Achilles tendon rupture? Is that what you do? Like I told you, this was a strategy so that you can memorize, you know all of them, right? And tetracycline, do you ask for penicillin allergy? Vancomycin, do you infuse it at least over 60 minutes? And then azithromycin, do you avoid sun exposure? You know it. I told you, sulfonamide, mostly sun. So this is wrong pairing. Sulfasalazine, you ask for penicillin allergy. Wrong pairing. Ciprofloxacin, what do you think? A, rupture, Achilles tendon rupture. That's cool. Tetracycline, you worry about pregnancy. And azithromycin, QT prolongation. Vancomycin, infused over 6 minutes. So the only thing that is paired appropriately is C and E. Those are the one right answer. The other one is wrong pairing. And this is reviewing prescription for a client prescribed what? Griperide. Which findings should cause the nurse to question the prescription? First, identify what is griperide. Its use is an anti-diabetic medication. Then select what that apply. What do you think? Client has type 1 diabetes. Should you question the use of griperide? Client is allergic to sulfur drug. Should you do that? Client takes metformin. Client last meal is 4 hours ago. Client has severe impaired liver function. Client report episode of hypoglycemia at home. What do you think? This is a concept. I want you to know if you know anything about griperide, but it's anti-diabetic medication. Which one do you think? Put down your answer in the comment. Let me know. Let me know. But I can tell you it's used for type 2 diabetes. Why? Because it needs to stimulate insulin. Type 1 diabetes don't have abilities to stimulate insulin. So it's the wrong answer. It's a sulfur drug. So if you have sulfur allergy, it is a problem. We should question that. You can take it with metformin. It's not a problem. And you need to eat with it. Therefore, if you eat last meal 4 hours ago, it causes hypoglycemia. Therefore, we should question. If your liver is affected, it's a problem. And if you report hypoglycemia at home, it's a problem. These are our contraindication with the use of griperide or any of the sulfonylurea medication. I can change the name and I can give you the same thing. You can use it to answer the same question. Which lab results indicate fluid overloaded? That means you have too much fluid in your system. You don't have to overthink it. What do you think? Decrease hematocrit, decrease serum sodium, increase BUN, decrease urine specific gravity, decrease serum osmolarity. If you have too much fluid, your blood level goes up, down. If you have too much fluid, your sodium go down. Too much fluid, your BUN go down. If you have too much fluid, your urine specific gravity go down and your blood become very thin, decrease osmolarity. Straightforward question. Don't overthink it. Same thing, a nurse is caring for a client who is diagnosed with what? Primary hypoparathyroidism. Why did they ask you so many questions on this? Because I want you to master it. Next time when you see it, this is you kill it. Which findings should the nurse anticipate? What is the key buzzword? Is primary hypoparathyroidism. What does that mean? Low calcium. What are you looking for? Signs and symptoms of low calcium. T signs, C signs, muscle cramp, bradycardia, seizures. How do I do it? When your calcium is low, there's a strategy where I do it. Low calcium, look for symptoms that is going up. That's all. Therefore, if you see that the symptoms is going up, you picking it. Which symptoms are going up? Those signs. It's going up. Chapstick sign is going up. Your muscle is cramping. It's going up. Bradycardia is going down. Seizures is going up. These are easy way to remember fluid electrolyte. This is electrolyte imbalance and signs and symptoms to master them. And let's review fluid restriction prescription for a client. I love this question. Several clients. Which order should the nurse question? That means who, when we restrict fluid on them, is a bad thing. That's all. I underline the question. Client with what? CHF, is it okay to restrict fluid? Client with pulmonary edema, is it okay to restrict fluid? Client with pneumonia, is it okay to restrict fluid? Client with emphysema, is it okay to restrict fluid? Who? When you restrict fluid, is bad. Put down in the comments your answer. But I can tell you, pneumonia. Why? Pneumonia need to break secretion, and you need fluid to break secretion. If you restrict fluid in them, they can't break secretion. CHF, You don't need to you need to restrict fluid because they have too much fluid in the system. Pulmonary edema, they have too much fluid. Emphysema does not need fluid, so restrict them because they are air trapping. Therefore, C is the right answer. And next is developing plan of care for infants with reflux. It doesn't matter whether he's an older, it's the same thing, gastroesophageal reflux. Which intervention should the nurse include? Select or apply. Small frequent meal. Minimize handling the infant after feeding. Taking their food with what? Rice cereal because it's a kid. Avoid citric food, avoid spicy food. So for reflux, I always say avoid irritant. And irritant is what? Citric food, spicy food. They are all irritant for this patient. And then which intervention should the nurse include? Sometimes you have to take in their rice so that it will be easy for them to swallow. And then they don't reflux. It's a kid. And then you should minimize handling them after you feed them so that they don't reflux. And you should provide small frequent meal at a time. So this one, small frequent meal at a time, minimize handling them, taking their food with cereal because it's a kid. And they should avoid citric food and spicy food. All of this is appropriate to include in the plan of care for a kid. And this is caring for a client. As you can see, these are our pediatric questions now. Pediatric nursing. A nurse is caring for a client after surgical repair of cleft lip or palate. Which intervention is appropriate? Select or apply. Position the child prone, apply elbow restraint, offer a pacifier for comfort, resume feeding using a cup, use a straw for oral intake. The key concept when it comes to cleft lip and cleft palate, we don't want them to suck anymore. And then we don't want injury on the repair. Therefore, position the prone is not appropriate. Apply elbow restraint so that the kid does not destroy the sutures. Pacifier is not good. They should drink from a cup. It doesn't require sucking. And they should use straw for intake. No, because they're going to suck on it. The one they need. And let's provide feeding education to parent of a infant with a cleft lip. Which strategy should the nurse recommend? Select or apply. When you see cleft lip or palate again, these three questions, you kill it. If you watch this video multiple times, use a specialized nipple, feed the infant in an upright position, burp the infant infrequently, allow the infant to feed laying flat, feed slowly, and allow rest period. The key is prevent aspiration because they swallow air, and then that will help them. What is the problem? They need a specialized nipple because of the gap. You need to feed them upright, otherwise they are going to choke. You need to burp them more frequent. They should not lay down and feed them slowly. You have 3 more questions. How are you doing? How are you doing? We are mastering concept. I know you got it. 3 more questions. And this is assessing an elderly client who lives alone. Which finding require follow-up? That means they live alone. Home, what? Improvement. Health promotion. That's what you're going to do. Select or apply. State using a lotion after bath. The elderly patient, that's what they say. What did they say again? Bath 2 to 3 times weekly. That's what they say. They report difficulty clipping toenails. Using hearing aid daily. Files the nails straight across. They hit one small meal at the day due to poor appetite. Which finding when you hear it should bother you in an elderly patient who live alone? Require follow-up. Which one should bother you? Hey, if you use lotion after bathing, it's okay. You bath 2 to 3 times, that's expected in your other patient. If you can't clip your toenail, we're going to get into trouble. You use your hearing aid daily, that's fine. When you clip in your nail, you go straight across. Yeah, that is very good. But if you eat one meal due to poor appetite, well, probably you have dental issue. Number is 80. Same thing. Health promotion. A community health nurse is screening clients during what? Secondary prevention screening, right? Which clients are increased risks of stroke? That's all. Community health nurse is screening clients during a secondary prevention program. Who has increased risk of stroke? Select and apply. Risk factor for stroke. Atrial fibrillation in the history. You smoke for 40 years. You have hyperlipidemia. You take blood pressure medication, 3 of them. Your BMI is high. You exercise once a week. Factor 5 Leiden. What do you think? Which of this is a problem? Make you more risk for stroke? What do you think? I can tell you all of them. AFib, there will be a clot going to your lung, from your lung and your heart to your brain, and that is a problem. You get stroke. Smoking, high problem for stroke, in addition to blood pressure. Hyperlipidemia, cholesterol problem, you have stroke. If you're taking blood pressure, 3 medication, you are on control. BMI, obesity, risk factor. Sedentary lifestyle, that's a problem. Factor 5 is clot formation, common cause of clot. These are all risk factors for stroke. And the last question. Thank you for staying. Thank you for making it to the end. 85 questions. We did the case study, so we end at 81. But you've done a good job. Let's finish this one. A client with BPH is being assessed in the clinic. Which factor increases the risk of what? Prostate cancer. What do you think? Risk factor for prostate. African descent. If you are older, family history of prostate cancer. If you have BPH and you're smoking. What do you think? Put down your answer. Number 81, 85 question, and we're done. Black, bad problem. Age over 65 if you have prostate cancer. But having BPH is not a risk factor, and smoking is mostly bladder risk factor for cancer. 85 questions, NCLEX practice question, NCLEX review question, NCLEX questions and answers, talking about everything you need to know for your test, fundamentals, select or apply, prioritization, pharmacology, endocrine, respiratory, everything. I give you maternity, newborn, peds, across, like assimilation of the NCLEX test, you see. Thank you for watching. And this video help you, just click on the button, subscribe for more content like that. But this RN, LPN benefit video is designed to make you pass. Take care and have a good day.